A blessed day to everyone. We are the Group 4 presenter, and the task given to us is clinical symptoms and disorder of the skeleton. But before we start, allow me to introduce myself. I am Hendrix Angelo B. Forte, and together, we will present to you first the disorder of skeleton. But first, what is skeletal disorders? These are any condition or disease that affects the bones and joints in the body. With this, skeletal disorders may hinder mobility and make our daily life challenging. So may I call Miss Calabag to discuss to us the first 6 skeletal disorders.
Ankylosing spondylitis, a chronic progressive inflammatory disease involving the spinal joints and surrounding soft tissues, most common in young males. It may also affect peripheral joints like the knees, ankles, and hips. Normally, the joints and ligaments in the spine help us move and bend. Ankylosing refers to stiffening or fusion, while spondylitis means spine or inflammation. Ankylosing spondylitis, it is a fusion of the spine due to inflammation. The cause of ankylosing spondylitis, studies show that both genes and environment may lead to the development of the disease. Researchers note that the HLA-B27 gene increases the risk of developing ankylosing spondylitis, but this does not mean you will get the disease if you have that gene. The HLA-B27 gene, or ito ay isang uri ng pagmamana, na kung saan ang isang miyembro ng pamilya ay nagkakaroon ng ankylosing spondylitis. The symptoms of ankylosing spondylitis is back pain and stiffness or pananakit sa likod, pain and swelling in the other part of the body, such as hip, knees, and ribs, fatigue or extreme tiredness, appetite loss, weight loss, fever, anemia, eye inflammation, and digestive illness. And this is how to prevent ankylosing spondylitis. Based on my research, there is no known way to prevent, but early diagnosis and treatment can help prevent or slow disease. Maintaining a healthy lifestyle, such as getting regular exercise, practice good posture, eating a balanced diet, take warm soak. All of these can help to prevent joint damage and reduce the risk of disease complication. And this is my recommendation on how to prevent ankylosing spondylitis. First, maintaining a healthy lifestyle can prevent this kind of disorder. Getting regular exercise can help our body healthy. Ankylosing, it is immobility and fixation of a joint. The cause of ankylosing has no known specific cause, though genetic factors seem to be involved. Symptoms: back pain, early morning stiffness, stoop posture in response to back pain, or appetite loss. How to avoid it? Self-care, stay active, don't smoke, practice good posture. And this is my recommendation on how to avoid ankylosing. Maintaining a healthy lifestyle, such as getting regular exercise and eating balanced diet. Arthritis, it is inflammation of a joint. It is not one disease alone, but an umbrella term for more than 100 conditions that affect the joints of the body, or it is also known as sakit sa buto. The cause of arthritis: arthritis is caused by the wear and tear of the joint over time or because of overuse. The symptoms of arthritis: joint pain, tenderness and stiffness, inflammation in around the joints, weakness and muscle wasting, warm red skin over affected joint. How to prevent? It is not always possible to prevent arthritis. There are hundreds of different types of arthritis, each with their own cause and risk factors. But if you want to prevent it, you should maintain a healthy lifestyle, stay at a healthy weight, Control your blood sugar, exercise every day, avoid injury, quit smoking. And this is my recommendation on how to prevent lifestyle and home remedies. Weight loss, excess weight puts extra stress on weight. Exercise, regular exercise can help keep joints flexible. Heat and cold, heating pads or ice packs may help relieve arthritis. And last, you need assistive devices. Chondrosarcoma, a malignant tumor or cartilage. It is a rare type of cancer that usually begins in the bones but can sometimes occur in the soft tissues near bones. The exact cause of chondrosarcoma, it is not known. There may be a genetic or chromosomal component that makes certain individuals more open to this type of malignancy. Chondrosarcomas have been observed as a late consequence of radiation therapy for others. The symptoms of chondrosarcoma: increasing pain, feeling of pressure around the lump, local swelling, joint stiffness. How to prevent chondrosarcoma? There is no known way to prevent chondrosarcoma. People with uncommon bone-related condition may be more likely to develop chondrosarcoma. Also, some scientists have noted a connect on between chondrosarcoma and injury to affected area. Recommendation: be aware of any pre-appointment restriction. Learn enough about cancer to make decision about your care. Keep friends and family. Find someone to talk with. Curvature of the spine. An exaggerated spinal curve such as scoliosis, lordosis, or kyphosis. Or it is a abnormal lateral curvature of the spine. It is most often diagnosed. Scoliosis, a sideways curve that makes the spine appear, or it is a S shape or C shape from the back. Lordosis, it is a sway back, an inward curve at the lower back, and kyphosis, an abnormally rounded upper back. Cause: a birth defect, a child growth, aging injury, or previous spine surgery. Symptoms: one hip appear higher than the other, one side of the rib cage is higher than the other when bending forward, one shoulder blade in the upper back is more prominent or visible than other. The four types of symptoms of scoliosis: a visibly curved spine, leaning to one side, uneven shoulder, shoulder blades with one shoulder or hip streaking out, the ribs streaking out on one side, clothes not fitting well. How to prevent curvature of the spine? Bracing may prevent a spinal curve from worsening, reduce pain, and improve mobility. Wearing a back brace, weight loss, surgery, medication to relieve pain and swelling, exercise and physical therapy to increase muscle strength and flexibility. And this is my recommendation. Avoid lifting a heavy. Degenerative joint disease or DJD, also known as osteoarthritis or OA. It is a common form of arthritis, wear and tear disease. Some people call it degenerative joint disease or wear and tear. It occurs most frequently in the hands, hips, and knees. With OA, the cartilage with the joint begins to break down and the underlying bone begins to change. Cause: typically chronic repetitive motion that result in inflammation and structural joint damage. Symptoms: pain, stiffness, loss of flexibility, weakness, deformed joints, damaged cartilage. How to prevent it? Keep a healthy weight. Extra weight puts stress on your joints of getting OA. Control your blood sugar. High blood sugar level raise your risk. Be active every day. Exercise is a good way to prevent. pay attention to pain. May I call Michaela Calvin to discuss the other parts of disorder.
Good day everyone, I'm Michaela Calvin, and today I'll be discussing the another 6 disorders. First, fracture. Fracture is a break in the bone. In an enclosed simple fracture, the broken bone does not penetrate the skin. In an open fracture, there is an accompanying wound in the skin. It is also partial or complete break in the bone, and it has many types of fracture, like stable fracture, compound fracture, transverse fracture, oblique fracture, and etc. Fractures are often caused by falls, trauma, or as a result of direct blow or kick to the body, and usually sa may wrist part or ankle part natin mostly nagkakaroon ng fracture. For the symptoms of having fracture, first, intense pain, swelling, bruising or bleeding, numbness and tingling, broken skin with bone protruding and limited mobility or inability to move a limb or put weight on the leg. For recommendation, use painkillers, the analgesics such as paracetamol and morphine, and to avoid inflammation, take inflammatory drugs like ibuprofen and naproxen. Next is gout. It is a form of acute arthritis, usually beginning in the knee or foot, caused by the deposit of uric acid salts in the joint. Gout also caused by the build-up of a substance called uric acid in the blood. This is considered as a stage 1 progression of having high uric acid. What is the meaning of high uric acid? Isa itong uri ng dumi or toxin sa katawan ng tao. And here are some signs when you are suffering in a gout: severe pain in one or more joints, swelling in around the affected joint feeling hot and very tender, red shiny skin in the affected joint. And for the recommendation to avoid gout, avoid eating sugary drinks, sweet foods, and game meats. Especially sa mga older people, you need to avoid eating those foods. And you need to eat more healthy foods and drink plenty of waters. Next is herniated disc, a protrusion of center nucleus pulpus of an intervertebral disc into the spinal canal, also called bulge, slip, or ruptured. Parang nagiging weak na yung sa may part ng lumbar mo, which is yung spinal canal sa likod mo or sa lower part. Causes of this is degenerative process in which as humans age, the nucleus pulpus became less hydrated and weakens. Nucleus pulpus sa may part or inner part Symptoms: pain that occurs in one side of the body, pain when you are moving your neck, or deep pain near the shoulder blade, and sharp pain in one part of the leg, hip, and buttocks. And for the medication, you use corticosteroids, and doing exercise regularly can help you to avoid this. Another one is kyphosis. It is an exaggerated culture or curve of the spine in the thoracic region, sway back. Older people, they can often feel this way, ang pagiging kuba. Children can also experience kyphosis. It caused by poor posture during your childhood, such as slouching, leaning back in chairs, and carrying heavy school bags. It can also result of abnormally shaped vertebrae or development and problems with spine. The symptoms of kyphosis: difference in shoulder height, the head bends forward compared to the rest of the body, tight hamstring, back tight muscles, and for medication, use pain relievers or take ibuprofen or acetaminophen, and we can also avoid having this by doing exercise. Next is lordosis. It's also an exaggerated curvature of the spine, but this time sa may lumbar region, humpback naman. Lordosis caused by uneven posture. Having overweight or weakness in the abdominal muscle can increase the risk as both factors strain the lower back. Here are the symptoms. Difficulty moving in certain ways, temporarily loss of bladder control, muscle pain and discomfort in the lower back and muscle. Lordosis can reduce by doing exercise. But according to the studies, strengthening your hamstring, hips, abs, and etc. ay maiiwasan natin ang magkaroon nito. Another one is osteoarthritis, OA, in Tagalog, rheuma. Progressive deterioration of joint of the cartilage with growth of new bone and soft tissue in and around the joint. And the most common form of arthritis results from wear and tear, injury or disease, also called degenerative joint disease. The commonly affected joints are knees and hands, in the ends or tips of your fingers. It goes by aging and being overweight or obese increase the strain on your joint and your wrist. And here are the symptoms. Joint tenderness, increased pain and stiffness when you have not moved your joints, weakness and loss of muscle bulk, limited range of movement in your joint and swelling. And for the recommendation, keep a healthy body weight by doing supervised exercise. And for the next presenter, may I call Miss Canceran to discuss the another 6 disorders.
Blessed day everyone, my name is Risa Canceran and I will discuss the osteogenic sarcoma, a malignant bone tumor, osteosarcoma. Osteosarcoma is a type of bone cancer that usually develops in the osteo blood cells that form bone. So, here are the cause. Mutations might tell cells to grow and divide. Uncontrollable to continue living when normal cells would die. Happen the accumulating abnormal cells can form a tumor. Here are the symptoms, including redness and warmth at the site of tumor, anemia, fever or lagnat, exhaustion or labis na pagkapagod, unexplained weight loss, medication or how to avoid osteogenic sarcoma. While it is always good to maintain a healthy weight, currently there are no known lifestyle changes that can prevent osteosarcoma. Is the osteomalacia, a softening and weakening of the bones due to vitamin D deficiency or other disease. Here are the cause. Osteomalacia develops most commonly due to vitamin D deficiency, often from not getting enough sunlight, or less frequently due to a digestive or kidney disorder. So here are the symptoms. Pain felt in the bones and joints, muscle pain and weaknesses, particularly following exercise. So here are my recommendation. You will also need to take larger dosage of calcium and vitamin D than the normal daily recommendation to treat broken or deformed bones from osteomalacia. Osteomyelitis, inflammation of the bone and bone marrow caused by infection, usually bacteria. Here are the cause. Bone infection is most often caused by bacteria, but it can also be caused by fungi or other germs. Here are the symptoms, including fever, swelling, and pain. Here are my recommendations. It's important to clean and treat arounds to keep out bacteria and prevent infections. Osteopenia, a lower than average bone density which may foreshadow osteoporosis. Here are the causes. The natural bone loss that occurs gradually during adulthood is considered to be cause of primary forms of osteopenia and osteoporosis. Here are the symptoms. Some people with osteopenia may experience bone pain or weaknesses. Or how to prevent osteopenia, including diet, exercise, and vitamin D. Osteoporosis, a condition characterized by reduction in bone density, most common in women past menopause. Predisposing factors include poor diet, inactivity, and low estrogen level. So here are the causes. How likely you are to develop osteoporosis depends partly on how much bone mass you attain in your youth. Here are the symptoms. Back pain or pananakit ng likod caused by a broken or collapsed bone in the spine. Loss of height over time. A stoop posture, a bone that breaks much more easily than expected. Here are the recommendations. Good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Paget disease, skeletal disease of the elderly characterized by bone thickening and distortion with bowing of long bones, osteolysis deformans. So here are the cause. The cause of Paget disease is unknown. It may be due to genetic factors but also could be due to a viral infection early in life or hypersensitivity to vitamin. Here are the symptoms. Most people who have Paget disease of bone have no symptoms. When symptoms occur, the most common complaint is bone pain. This is how to prevent Paget disease. There are no known ways to prevent Paget disease from occurring. Eating a healthy diet with sufficient calcium and vitamin D and getting regular exercise are important components in maintaining skeletal health and joint mobility. Blessed day everyone, my name is Riza Gansaran and I will discuss the osteogenic sarcoma, a malignant bone tumor, osteosarcoma. Osteosarcoma is a type of bone cancer that usually develops in the osteoblood cells that form bone. So, here are the causes. Mutations might tell cells to grow and divide. Uncontrollable to continue living when normal cells would die. Happen the accumulating abnormal cells can form a tumor. Here are the symptoms, including redness and warmth at the site of tumor, anemia, fever or lagnat, exhaustion or labis na pagkapagod, unexplained weight loss, medication or how to avoid osteogenic sarcoma. While it is always good to maintain a healthy weight, currently there are no known lifestyle changes that can prevent osteosarcoma. Is the osteomalacia, a softening and weakening of the bones due to vitamin D deficiency or other disease. Here are the causes. Osteomalacia develops most commonly due to vitamin D deficiency, often from not getting enough sunlight, or less frequently due to a digestive or kidney disorder. So here are the symptoms. Pain felt in the bones and joints, muscle pain and weaknesses, particularly following exercise. So here are my recommendation. You will also need to take larger dosage of calcium and vitamin D than the normal daily recommendation to treat broken or deformed bones from osteomalacia. Osteomyelitis. Inflammation of the bone and bone marrow caused by infection, usually bacteria. Here are the cause. Bone infection is most often caused by bacteria, but it can also be caused by fungi or other germs. Here are the symptoms, including fever, swelling, and pain. Here are my recommendation. It's important to clean and treat arounds to keep out bacteria and prevent infections. Osteopenia, a lower than average bone density which may foreshadow osteoporosis. Here are the cause. The natural bone loss that occurs gradually during adulthood is considered to be cause of primary forms of osteopenia and osteoporosis. Here are the symptoms. Some people with osteopenia may experience bone pain or weaknesses. Or how to prevent osteopenia, including diet, exercise, and vitamin D. Osteoporosis, a condition characterized by reduction in bone density, most common in white women past menopause. Predisposing factors include poor diet, inactivity, and low estrogen level. So here are the causes. How likely you are to develop osteoporosis depends partly on how much bone mass you attain in your youth. Here are the symptoms: back pain or pananakit ng likod caused by a broken or collapsed bone in the spine, loss of height over time, a stoop posture, a bone that breaks much more easily than expected. Here are the recommendations. Good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Paget disease, skeletal disease of the elderly characterized by bone thickening and distortion with bowing of long bones, osteotis deformans. So here are the cause. The cause of Paget disease is unknown. It may be due to genetic factors but also could be due to a viral infection early in life or hypersensitivity to vitamin. Here are the symptoms. Most people who have Paget disease of bone have no symptoms. When symptoms occur, the most common complaint is bone pain. This is how to prevent Paget disease. There are no known ways to prevent Paget disease from occurring. Eating a healthy diet with sufficient calcium and vitamin D and getting regular exercise are important components in maintaining skeletal health and joint mobility.
Good day everyone, I'm Anas Danao. So first, let me discuss what is Pat disease. Pat disease is the inflammation of the vertebrae, usually caused by tuberculosis. Pat disease typically begins in the vertebral bodies which are the bones that make up the spine. The bacteria can spread to the intervertebral disc, which are cushions between the vertebrae. Over time, the infection can destroy the vertebrae and disc, leading to spinal deformity and instability. So what causes the Pat disease? It is caused by the bacteria called Mycobacterium tuberculosis. TB is a contagious disease that can spread through the air when an infected person coughs, sneezes, or speaks. So the symptoms of Pat disease are back pain, stiffness in the spine, muscle weakness in the legs, loss of sensation in the legs, kyphosis or hunchback, and abscesses in the back. The medication for Pat disease is a four-drug regimen of antibiotics that is only available with your doctor's prescription to avoid potential misuse. The medications are isoniazid, rifampin, pyrazinamide, and ethambutol. These medications are typically taken for 6 to 9 months depending on the severity of the infection. So how to avoid Pat disease? The best way to avoid Pat disease is to get vaccinated against TB. The TB vaccine known as the Bacillus calmette-guerin vaccine. It is not completely effective at preventing TB, but it can reduce the risk of developing severe Pat disease. If Pat disease is not treated, it can lead to serious complications such as paralysis and death. So if you have any of the symptoms for Pat disease, it is important to see a doctor regularly for checkups to avoid any fatal outcome. So the second one is rheumatoid arthritis, a chronic autoimmune disease of unknown origin resulting in inflammation of peripheral joints and related structures, more common in women than men. So, ang rheumatoid arthritis is caused when the immune system mistakenly attacks the synovial membrane, the tissue that lines the joints. This inflammation can cause the synovial membrane to thicken and produce excess fluid, which can lead to joint swelling and pain. Over time, inflammation can damage the cartilage and bone in the joints, leading to joint deformity and disability. Rheumatoid arthritis can also affect other parts of the body such as lungs, heart, blood vessels, skin, and eyes. So, the exact cause of rheumatoid arthritis is unknown. Rheumatoid arthritis is an autoimmune disease, which means the body's immune system attacks its own healthy tissues. Symptoms of rheumatoid arthritis. So, pain, swelling, stiffness and tenderness of the joints, especially the small joints of the hands and feet. Morning stiffness that lasts for at least 30 minutes. Fatigue, fever, weight loss, loss of appetite, difficulty of sleeping, dry eyes and mouth, and lumps under the skin or the rheumatoid nodules. Medications for rheumatoid arthritis. They are the over-the-counter pain relievers such as ibuprofen or acetaminophen, prescription medications such as non-steroidal anti-inflammatory drugs or the NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs. So how to avoid rheumatoid arthritis? There is no known way to prevent rheumatoid arthritis, but there are some things you do to reduce the risk of developing rheumatoid arthritis. You need to quit smoking, maintain a healthy weight, exercise regularly, eating a healthy diet, and getting enough sleep. If you have any of these symptoms, it is important to see a doctor right away. Early diagnosis and treatment can help to prevent joint damage and disability. So the next one is rheumatoid factor, a group of antibodies found in the blood in case of rheumatoid arthritis and other systemic disease. So, rheumatoid factor does not typically cause any symptom on its own. It is a type of antibody that the body produces when it is attacking itself. Antibodies are proteins that the body produces to fight infection. However, in people with rheumatoid arthritis, the body produces antibodies that attacks the synovium, the lining of the joints. This can cause inflammation and damage to the joints. Rheumatoid factor is not a specific test for rheumatoid arthritis, but it can be used to help diagnose the disease. It is also used to monitor the severity of rheumatoid arthritis and to track the response to treatment. Rheumatoid factor is present in the blood of about 80% of people with rheumatoid factor. However, it can be also present in people with other autoimmune disease such as lupus and as well as in people with chronic infections such as hepatitis C. So the next one is rickets. Rickets is a faulty bone formation in children, usually caused by deficiency of vitamin D. Rickets is a bone disease that affects children. Rickets is most common in children ages 6 to 24 months. This is because their bones grow rapidly during this period. So what causes rickets? It is caused by a lack of vitamin D, calcium, or phosphorus. Vitamin D helps the body absorb calcium and phosphorus from food. Calcium and phosphorus are essential for bone growth and development. Without enough vitamin D, calcium or phosphorus, bones cannot grow properly. So, what are the symptoms of rickets? Soft and weak bones, bone pain, muscle weakness, deformities of the bone and joints such as bowed legs, knock-knees, and a large forehead, and sun growth. So, how to avoid rickets? Make sure your child gets enough vitamin D. Encourage your child to spend time outdoors in the sunlight. Give your child a vitamin D supplement and make sure your child eats a healthy diet. Recommendations. If you think your child may have rickets, it is important to see a doctor right away. If rickets is not treated, it may lead to serious complications such as fractures, deformities of the spine, and problems with walking and running. So, the next one is sciatica. Sciatica is a severe pain in the leg along the course of the sciatic nerve, usually related to spinal nerve root irritation. So, sciatica happens when irritation, inflammation, pinching or compression affect one or more nerves that run down your lower back and into your legs. So, what causes sciatica? Sciatica is a condition that causes pain, numbness, or tingling in the leg. It is caused by pressure on the sciatic nerve, which is the longest nerve in the body. The sciatic nerve runs from the lower back down the back of each leg. It can be also caused by herniated disc, spinal stenosis, degenerative disc disease, pregnancy, and trauma. So the symptoms of sciatica are pain in the lower back, buttock, and leg. The pain may be sharp, tingling, or burning. Numbness, tingling or weakness in the leg or foot. Difficulty moving the leg or foot. Pain that worsens when sitting or standing for long periods of time or when coughing or sneezing. How to avoid sciatica? Maintain a healthy weight, exercise regularly, use proper lifting techniques, avoid sitting or standing for long periods of time, and maintain a good posture. The medications for sciatica are over-the-counter pain relievers such as acetaminophen, aspirin, or NSAIDs such as ibuprofen, Advil, Motrin, Ketoprine, or Naproxen. Prescription muscle relaxants to ease muscle spasm. Antidepressants for chronic low back pain. Prescription pain medications for more severe pain. So if you have any of the symptoms of sciatica, it is important to see a doctor to get a diagnosis and treatment plan. So the next is scoliosis, a sideways curvature of the spine in any region. It is most commonly diagnosed in adolescents, but it can occur at any age. Scoliosis can be mild or severe, and it can affect the entire spine or just a portion of it. So, although scoliosis is thought to be caused by a combination of genetic and environmental factors, some people are more likely to develop scoliosis if they have a family history of scoliosis. But here are the possible causes of scoliosis: birth defects, neuromuscular conditions, injuries or infections, and uneven leg length. So, what are the symptoms of scoliosis? Uneven shoulders, one shoulder blade that appears more prominent than the other, uneven waist, one hip higher than the other, one side of the rib cage jutting forward, a prominence on one side of the back when bending forward, back pain, muscle weakness in the legs, stiffness in the spine, lost sensation in the legs, kyphosis or hunchback, and abscesses in the back. So, but there is no known way to prevent scoliosis. So, if you have a family history of scoliosis, it is important to see a doctor regularly for checkups. Early diagnosis and treatment of scoliosis can help prevent complications. The medication for scoliosis are non-steroidal anti-inflammatory drugs or NSAIDs, muscle relaxants, physical therapy or yung bracing, yung parang may sinusuot kang belt kanon and surgery. But addition lang na info about sa scoliosis na yung pagbubuhat daw ng mabigat tsaka yung poor posture ay nagkakos ng scoliosis is hindi totoo. So, that's all for my report. May we have Bea De La Rosa to discuss the other disorders.
A blessed day to everyone. I am Bea De La Rosa, and today I will discuss to you the last two topics of clinical disorders. The first one is spondylolisthesis. So what is spondylolisthesis? It is the forward displacement of one vertebra over another. In short, it is the slippage of vertebra. So what are the causes? The first one is the ligament laxity. When we say ligament laxity, it is a condition where ligaments, the tissue that connects bones at the joint, are loose and allow more flexibility and range of motion than normal. The second one is the fracture of the pars articularis. When we say pars articularis, it is the part of vertebra located between the inferior and superior articular process of the facet joint. For the symptoms, muscle spasms, also known as muscle cramps in the hamstring. Hamstring is the muscles in the back of our thighs. The second one is back stiffness. Third one, difficulty walking or standing for long periods. Pain when bending over, and numbness, weakness, or tingling in the foot. For the treatments, of course, you need to take a rest or take a break from strenuous activities and sports. For For medication, we can use non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen and naproxen. If these don't work, your healthcare provider may prescribe other medications. So how do healthcare providers treat spondylolisthesis? Treatment depends on the grade of the slippage, your symptoms, age, and overall health. Your healthcare provider will discuss treatment options with you. You may need medication, physical therapy, or surgery. The second one is the spondylolysis. So what is spondylolysis? Spondylolysis is the degeneration of the articulating portions of the vertebra, allowing for spinal distortion, specifically in the lumbar region. So what are the causes? The first one is overuse. When we say overuse, repetitive motions that put stress on your lower back cause wear and tear on your vertebrae. Over time, this damage can add up to cause a pars fracture. Doing physical work for your job, playing contact sports, and repeatedly injuring your lower back can all damage your vertebrae. For the second one is growth spurt. So what is growth spurt? It is a period when their bodies are physically growing and changing quickly. Some kids and teens develop spondylolysis when they are going through a growth spurt. For the last one is genetics. Some people are born with thinner vertebrae, so this can make you more likely to experience a pars fracture. For the symptoms, lower back pain is the most common spondylolysis symptom. The pain usually spreads or radiates from your lower back into your thigh and butt muscles, are also known as buttocks. Second one is feels like a muscle strain in or around your lower back, and for the last one, get worse during physical activity and improve with rest or when you're less active. For medication, it depends on the doctor, of course, or how are affected and how severe your cracks. The most common treatments include rest, of course. Taking a break from sports and other intense physical activities reduces stress on your spine. For medication, we can also use NSAIDs or non-steroidal anti-inflammatory drugs can help reduce pain and inflammation. But don't take over-the-counter pain relievers for more than 10 days in a row without talking to your healthcare provider. So this is the end of the clinical disorder, and for the clinical symptoms will be discussed after. Thank you. Good day to everyone. I am Bea de la Rosa, and today I will discuss to you the first 3 clinical symptoms. But before we proceed to clinical symptoms, let me define first what is condition and symptoms. For the condition, it refers to the state of a person's health or the specific way of their body functions. It can be used to describe illness, diseases, injuries, or other medical issues. And for the symptoms is a subjective change in person's physical or mental state that is a sign or indication of disease or ill health. Symptoms are distinguished from signs, which are objective indication of disease. So the first clinical symptoms is the achondroplasia. So what is achondroplasia? It is the decreased growth of cartilage in the growth plate of long bones resulting in dwarfism. It is a genetic disorder. When we say achondroplasia, infants born with achondroplasia normally have weak muscle tone or hypotonia, which could delay motor skill development. What are the causes? Achondroplasia is caused by a gene mutation in the receptor that converts cartilage to bone during fetal development. So what are the symptoms? The first one is bones are shortened, thigh or upper arm part. The second one is short hands and feet, large separation between third and fourth fingers, maximum height of 4 feet, head larger than normal, prominent forehead, flat-nosed, and delayed development in infants, sitting or crawling or walking. So how will we manage the symptoms? The first one is weight management and encouraging healthy eating habits to prevent obesity. The second one is surgery to decrease fluid pressure on your brain or to correct a life-threatening complication called craniocervical junction compression. The next one is surgery to remove adenoids and tonsils. And the last one is growth hormones. The next one is the Baker cyst. So what is Baker cyst? It is a mass formed at the knee by distension of the bursa with excessive synovial fluid resulting from chronic irritation. What are the causes? A Baker cyst is a fluid-filled growth behind the knee. It causes a bulge and feeling of tightness, also called a popliteal cyst. What are the symptoms? In some cases, a Baker cyst causes no pain and you may not notice it. If you do have symptoms, they might include swelling behind the knee and sometimes in the leg, knee pain and stiffness and inability to fully flex the knee. The next one is bunion. So what is bunion? It is the inflammation and enlargement of the metatarsal joint of the great toe, usually with displacement of the great toe towards the other toes. What are the causes? There are many theories about how bunions develop, but the exact cause is unknown. Factors likely include inherited foot type, foot stress or injuries, and deformities present at birth. The symptoms are a bulging bump on the outside of the base of your big toe, swelling, redness or soreness around your big toe joint, corns or calluses. These often develop where the first and second toes rub against each other, ongoing pain or pain that comes and goes, and the last one is limited movement of your big toe. Bursitis. It is the inflammation of a bursa. A small fluid-filled sac near a joint causes injury, irritation, and joint disease. The shoulder, hip, elbow, and knee are common sites. What are the causes? The most common causes of bursitis are repetitive motions or positions that put pressure on the bursae around a joint. Examples include throwing a baseball or lifting something over your head repeatedly, leaning on your elbow for the long periods, and extensive kneeling for tasks. The symptoms: if you have bursitis, the affected joint might feel itchy or stiff, hurt more when you move.
Thank you, Ms. De La Rosa. Carpal tunnel syndrome. A carpal tunnel syndrome is a common neurological disorder that occurs when the median nerve, which runs from your forearm into the palm of the hand, becomes pressed or squeezed at the wrist. And this is the cause of carpal tunnel syndrome. Carpal tunnel syndrome caused by pressure on the median nerve. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of the hand. When the median nerve is compressed, symptoms can include numbness, tingling, and weakness in the hand and arm. And this is the symptoms: burning, tingling or itching, numbness in your palm and thumb or your index and middle fingers, weakness in your hand and trouble holding things, shock-like feeling that move into your fingers, tingling that moves up into your arm. And this is the medication or how to prevent carpal tunnel. The treatments for carpal tunnel syndrome range from non-invasive treatments such as splinting or hand therapy to work on ergonomics and nerve blending exercises to injections, which may also provide diagnostic information or for persistent or severe cases. Patients may require surgery. The second one is chondromas. Chondromas are benign, not cancerous tumors made of cartilage that are found mostly in the small bones of the hand and feet. They can also occur in the humerus, upper arm, femur, thigh bone, and ribs. These tumors rarely produce symptoms but can cause the affected bone to easily fracture. The exact cause of chondromas is unknown. Some research indicates that they may result when cells turn into cartilage instead of bone. It is not believed that the tumors are caused by radiation or chemical exposure or by any specific activity. Symptoms. In rare cases, a chondroma can turn into cancer. When it does, it's called a chondrosarcoma. Symptoms of chondrosarcoma in the skull base include a mass or bump, headache, swelling, vision changes, or hearing problems. And this is the medication and how to prevent. Most chondrosarcomas require a procedure to cut away more of the bone in order to remove all of the cancer. For chondrosarcoma in an arm or a leg, it might be necessary to remove the entire limb. When possible, surgeons remove the cancer in a way that preserves the limb. The third one is Ewing sarcoma. Ewing sarcoma is the second most common primary malignant bone tumor, mostly affecting adolescents in the second decade of their life, and it is a highly metastatic class of sarcoma. Like other types of bone cancer, the exact cause of Ewing sarcoma is unknown, as the condition tends to predominantly affect older children and teenagers. One theory is that it may be related to fast-growing bones. Symptoms. The main symptoms are pain in the affected area that gets progressively worse, and swelling and tenderness. Other possible, but less common, symptoms may include a high temperature fever, severe tiredness, and weight loss. In some cases of Ewing sarcoma, there may not be any symptoms at all. And this is the medication and how to prevent. There is no standard treatment for recurrent Ewing sarcoma, but treatment option may include the following: combination chemotherapy and surgery, radiation therapy to bone tumors as palliative therapy to relieve symptoms and improve the quality of life. Ewing sarcoma prevention. While it is always good to maintain a healthy weight and to quit smoking or using tobacco, there are currently no known lifestyle changes that can prevent Ewing sarcoma. The fourth one is exostosis. Anexostosis is an extra growth of bone that extends outward from an existing bone. Common type of exostosis include bone spurs, which are bony growths also known as osteophytes. Anexostosis can occur on any bone but is often found in the feet, hip region, or ear canal. The causes of exostosis depend on the type and location of the bone overgrowths. Common causes include injury, chronic irritation of a bone, or a family history of exostosis. In some cases, the cause of exostosis is unknown. And this is the symptoms: pain near the joint, stiffness, limited movement, bumps especially in the hands or feet, swelling, weakness, numbness, and one leg or arm longer than the other. And this is the medication and how to prevent. Apply ice to help with swelling. Take non-steroidal anti-inflammatory drugs such as ibuprofen. Use shoe inserts for bone spurs in your feet. Lost weight to put less stress on your joints rest. The fifth one is giant cell tumor. A giant cell tumor is a rare, aggressive non-cancerous tumor. It usually develops near a joint at the end of the bone. Most occur in the long bones of the legs and arms. Giant cell tumor most often occur in young adults when skeletal bone growth is complete. The exact cause of giant cell tumor remains unknown. The exact cause of giant cell tumors remains unknown. In some cases, they have been linked to Paget disease of bone. This is a chronic bone disorders in which bones become enlarged and mishappen. The symptoms is joint pain, swelling, and limited movement. This is medication and how to prevent. The goal for treatment of giant cell tumor is to remove their tumor and prevent bone damage. Treatment may include amputation in severe cases, bone grafting, bone reconstruction, physical therapy to regain strength and mobility, surgery to remove the tumor and any damaged bone. The last one is a hammer toe. A hammer toe is a deformity of the second, third, or fourth toes. In this condition, the toe is bent at the middle joint so that it resembles a hammer. Initially, hammer toes are flexible and can be corrected with simple measures, but if left untreated, they can become fixed and require surgery. The cause of a hammer toe is the muscle of each toe work in pairs. When the toe muscles get out of balance, a hammer toe can form. Muscle imbalance puts a lot of pressure on your toes, tendons, and joints. This pressure forces your toe into hammerhead shape. Causes include shoes that don't fit. If your shoes are too tight, too short, or too pointy, they push your toes out of balance. Pointy, high-heeled shoes put particularly severe pressure on the toes. And these are the symptoms. A joint in your toe that's getting rigid. Pain, usually at the top of your bent toe. Pain in the ball of your foot. Corns and calluses at the top of your joint. Redness, inflammation, or burning sensation. Restricted or painful motion of your toe joint. Swelling at your joint. This is the medication and how to prevent. Hammer toe can often be treated with non-surgical methods to stretch, strengthen, and improve the toe muscles. Our orthopedic specialist may suggest the following changes in lifestyle and conservative therapies to improve hammer toe. That's all, and may I call on Miss Ferraro to discuss the other disorders. Thank you.
A blessed day to everyone. I am John Lloyd Domingo, and I am going to explain the additional parts of skeletal symptoms and disorder. So let's start with hallux valgus. Definition of the disorder: painful condition involving lateral displacement of the great toe at the metatarsal joint. There is also enlargement of the metatarsal head and bunion formation. The cause of hallux valgus. The exact cause of hallux valgus is often multifactorial and can include genetic factors, wearing ill-fitting shoes, and abnormalities in foot structure. It can also be associated with conditions like rheumatoid arthritis. Symptoms of hallux valgus. Symptoms may include pain, swelling, redness, and reduced mobility at the base of the big toe. The bony bump can also make it difficult to find comfortable footwear. How to avoid hallux valgus? Conservative management includes wearing comfortable, well-fitting shoes and using orthotic devices. In severe cases, surgical correction may be considered. Next, Herbiden nodes. Definition of the disorder: small, hard nodules formed in the cartilage of the distal finger joint in osteoarthritis. The cause of Herbiden nodes. The primary cause is osteoarthritis, which is a degenerative joint disease. It's believed to be related to both genetic and environmental factors. Symptoms of Herbiden nodes. Herbiden nodes can cause joint pain, stiffness, and reduced finger mobility. They often develop slowly over time. How to avoid Herbiden nodes? Treatment focuses on managing the underlying osteoarthritis. This can include pain relief, physical therapy, and in some cases, surgery. Next, hemarthrosis. Definition of the disorder: bleeding into a joint cavity. The cause of hemarthrosis. Hemarthrosis is most commonly associated with bleeding disorders like hemophilia, where the blood lacks clotting factors, making it easier to bleed into joints. It can also result from joint injuries or trauma, such as sports injuries or accidents. Symptoms of hemarthrosis: joint pain and swelling, limited joint mobility, warmth and redness around the affected joint. How to avoid hemarthrosis? Treatment depends on the underlying cause. In cases of hemophilia or other bleeding disorders, individuals often require clotting factor replacement therapy. For joint injuries, rest, ice, compression, and elevation, rise for short, can help manage the condition. To avoid hemarthrosis, individuals with bleeding disorder should follow their prescribed treatment plans, and those at risk of joint injuries should take precautions to prevent trauma. Next, Legg-Calvé-Partis disease. The definition of the disorder: degeneration or osteochondrosis of the femur's proximal growth center. The bone is eventually restored, but there is a lot of deformity and weakness. Most common in young boys, also called coxa-plana. The cause of Legg-Calvé-Partis disease. The exact cause is unknown, but it is believed to be related to a disruption in the blood supply to the hip joint, leading to the depth of bone tissue in the femoral head. The symptoms of Legg-Calvé-Partis disease is hip or thigh pain, limping, limited range of motion in the hip. Pain may come and go over time. How to avoid Legg-Calvé-Partis disease? Treat often involves rest, physical therapy, and in some cases, bracing or casting to protect the hip. And also surgical intervention may be necessary in severe cases. Next, multimyeloma. Definition of the disorder: a cancer of blood-forming cells in the bone marrow. Cause of multimyeloma. The exact cause is unclear, but it is related to genetic mutations and risk factors like age, family history, and exposure to certain chemicals. Symptoms of multimyeloma: bone pain and fractures, anemia, which can cause fatigue, kidney problems, frequent infections, high levels of abnormal proteins in the blood and urine. How to avoid multimyeloma? Treatment includes chemotherapy, targeted therapy, stem cell transplants, and supportive care. There is no guaranteed way to avoid multimyeloma, but a healthy lifestyle and avoiding known risk factors can help reduce the risk. Next, neurogenic arthropathy. The definition of the disorder: degenerative joint disease caused by impaired nervous stimulation, most caused in diabetes mellitus, Charcot arthropathy. The cause of neurogenic arthropathy. The primary cause is nerve damage, which affects the joint ability to feel pain and respond to injury, leading to joint degeneration. The symptoms of neurogenic arthropathy: swelling and warmth around the affected joint, limited joint mobility, and joint deformity and instability. How to avoid neurogenic arthropathy? Management includes addressing the underlying condition and protecting the affected joint, Pain management and physical therapy can also be part of treatment. That's all. May I call Ms. Ferraro to explain the additional parts?
So good morning everyone. I am Eileen Ferraro and I will be discussing the other symptoms. So the Osgood-Schlatter disease. It is the degeneration or osteochondrosis of the tibia's proximal growth center causing pain and tendinitis at the knee. It is a condition that happens when a tendon in the knee or the patellar tendon pull against the top of the shin bone. This causes pain in the knee and the upper shin. The causes. Osgood-Schlatter disease happens during the growth spurt of puberty, and activities and sports cause this to happen over and over, which causes injury to the growth plate. So these are the symptoms. Pain when running, walking, kneeling, or going up downstairs. Pain, swelling, or tenderness in the knee or lower leg. And lastly is the increased warmth around the area of the tibial tubercle. So to ease the pain associated with Osgood-Schlatter disease, you can try to rest or avoid activities and sports that require jumping, running, and bending. Apply a cold compress to your knee to reduce swelling and relieve the tenderness and pain. And for the medication, take over-the-counter non-steroidal anti-inflammatory drugs as your doctor directs for pain relief. So next is the osteochondroma. Osteochondroma is a benign tumor consisting of cartilage and bone. So which means osteochondroma is a non-cancerous growth of cartilage and bone. Because osteo means bone, chondro means cartilage, and oma means tumor. It is the most common kind of benign bone tumor. It usually appears near the ends of long bones where new bone growth occurs in children and teens. This is the growth plate, a disc of developing cartilage tissue that eventually hardens into bone. Osteochondroma is an abnormal outgrowth of the growth plate. What causes of osteochondroma? So the cause of osteochondroma is unknown, but the tumor is thought to be related to an abnormality in the growth plate causing a bony prominence to grow away from the bone. So what are the symptoms of osteochondroma? Most cases do not cause symptoms. They often go undiagnosed until they show up on an imaging test taken from unrelated reason. However, you might notice a small hard lump on one of your bones. Pain with a particular movement if the tumor is rubbing against a tendon. Numbness or tingling in a particular spot if the tumor is putting pressure on one of your nerves. And last is the circulation problems in a limb if the tumor is inhibiting a blood vessel. In more severe cases, multiple osteochondromas can affect normal bone growth in children. Children with this condition might be unusually short, have a crooked limb, have an arm or leg that is longer than the other, and have a displaced hip joint. So most cases of osteochondroma won't require any treatment, but your healthcare provider may want to take periodic x-rays to keep track of its growth, though they also want to know if it's causing any pain or other symptoms. If so, they may recommend surgery to remove it. Another one is the osteochondrosis. Osteochondrosis is a disease of bone's growth center in children. Tissue degeneration is followed by recalcification. Osteochondrosis has no single known cause, but common factors include stress to the bone, reduced blood supply to the affected area, and trauma to the bone. Osteochondrosis can also occur as a result of athletic activity and sports injury. Osteochondrosis is almost exclusively found in children and teenagers up to roughly age 20. So here are the symptoms of osteochondrosis. Though some cases of osteochondrosis can occur and heal without you even knowing, the most common symptom is pain near the affected joint. Symptoms may include swelling, tenderness, joint popping, joint locking, joint weakness, joint stiffness, and an inability to fully straighten the affected limb. So doctors can easily diagnose osteochondrosis using X-rays. A number of treatments for osteochondrosis are available and include the following. Doctors often suggest resting the area of the body where there's a pain. Second is sometimes you can use a brace or a cast. And for some types of osteochondrosis, exercises and stretches can help strengthen the muscles and tendons around the affected joint. And last, in rare cases of osteochondrosis, surgery may be necessary to remove problematic bone fragments. And next is the osteodystrophy. It is an abnormal bone development. Osteodystrophy is a medical term used to describe abnormal changes in the growth and formation of bone. It is most commonly the result of chronic kidney disease. In children, osteodystrophy can cause bone malformation and short stature, while adults may experience brittle bones and fractures. The causes of osteodystrophy. When phosphorus levels rise in the bloodstream, calcium levels drop because phosphorus combines with calcium to form calcium phosphate. The second is, when calcium levels drop, the parathyroid glands release parathyroid hormone in an effort to restore the balance between phosphorus and calcium levels. In order to do this, however, the parathyroid hormone removes calcium from bones and places it into the bloodstream, causing bone mineral loss and/or the impairment of bone remodeling. The symptoms of osteodystrophy: bone pain, joint pain, bone deformity, and pathologic fracture. So osteodystrophy is treated with a combination of medications, nutritional supplements, diet, and exercise. Given the renal osteodystrophy most often occurs in people with kidney failure, hemodialysis is typically involved. The next one is osteogenesis imperfecta. It is the hereditary disease resulting in the formation of brittle bones that fractures easily. There is faulty synthesis of collagen, the main structural protein in connective tissues. The causes of osteogenesis imperfecta is caused by defects in or related to a protein called type 1 collagen. It is also occurs because of a gene mutation or change. This mutation may be sporadic or random, or a baby may inherit the gene from one or both parents. Osteogenesis symptoms include easily broken bones, bone deformities such as bowing of the legs, discoloration of the white of the eye, may be blue or gray in color, a barrel-shaped chest, a curved spine, a triangle-shaped face, loose joints, muscle weakness, skin that easily bruises, hearing loss in early adulthood, and soft discolored teeth. How is osteogenesis imperfecta treated? The goal of treatment is to increase bone strength and help people with osteogenesis imperfecta live more independently. Osteogenesis imperfecta treatment may include occupational therapy. Occupational therapy addresses fine motor skills such as buttoning your shirt or tying your shoes. Second is physical therapy. Physical therapists prescribe exercises that increase strength, flexibility, and range of motion. And last is the medications. Depending on your symptoms, your provider may prescribe medicines that slow bone loss or treat pain. And also, if you or your child breaks a bone, an orthopedic specialist or bone specialist can treat it. Treatment may include braces, splints, or casts. An orthopedic specialist may use protective devices to stabilize broken bones during healing or after surgery. And also, treatment may include surgery. Your provider may operate to correct curve or misshapen bones. Rodding surgery is a common treatment for children with osteogenesis imperfect. It uses a rod to prevent bones from breaking. Osteogenesis imperfect or brittle bone disease is a genetic condition. You cannot prevent it. If you or your partner has osteogenesis imperfect or have a relative with the condition, speak with a genetic counselor. They can advise you about the risk of passing on the condition. And the last symptoms that I will discuss is osteoma. Osteoma is a benign bone tumor that usually remains small and localizes. They are usually found in the head or skull, but they can also be found in the neck. Causes of osteoma development that have been theorized include congenital, inflammatory, and traumatic factors. In most cases, osteomas do not cause symptoms. In fact, a person may not realize that they have a growth until a doctor examines the cyanosis or the skull due to other health concerns the person has. The size and location of the osteoma may contribute to its potential symptoms. For example, smaller growths are less likely to cause symptoms. Larger growths are more likely to cause symptoms based on their location. The following are some potential locations of osteomas. Forehead or skull. An osteoma on the forehead or skull may cause headaches. An osteoma in the ear could cause temporary hearing loss. This will usually resolve with treatment. If you have an osteoma and it is not causing any symptoms, your doctor may recommend leaving it alone. But if you are in pain or it's noticeable on your face, your osteoma treatment options include surgery. So let's have Mr. Hendrix Fuerte to discuss the last 7 symptoms.
Thank you, Miss Elaine. So, Reiter syndrome, or also known as reactive arthritis. Reiter syndrome or reactive arthritis is a chronic polyarthritis that usually affects young men. It occurs after a bacterial infection, and it is common in those infected with HIV. It may also involve the eyes and genitourinary tract. Based from the word chronic polyarthritis, from the prefix word poly, means many or more, and arthritis, inflammation of joints. So basically, Reiter syndrome, it means 5 or more of our joints have arthritis at the same time. And based from that, Reiter syndrome is considered as malignant. So what are the causes of Reiter syndrome? Actually, the main cause is still unknown, but research suggests that the disease is caused by genetic predisposition. When we say genetic predisposition, it basically means parang hereditary siya, guys. Approximately 75% of those with condition have positive blood tests for genetic marker. And the second symptom is, di ba nasabi natin kanina, guys, na it is common in those infected with HIV. Bakit nga ba? Ito, in sexually active males, most cases of it follow infection with Chlamydia trachomatis and Urea plasma urealyticum. And these are bacterial, both sexually transmitted diseases. So let's proceed to the symptoms of Prader syndrome. First symptoms are painful urination and a discharge from the penis. If there is an inflammation of the urethra, parang ganon. And second, followed by arthritis 4 to 28 days later that affects the fingers, toes, ankles, hips, and knee joints. Other symptoms are mouth ulcers, inflammation of the eye, and back pain. The treatments or medications, it is said to be NSAIDs like naproxen, aspirin, or ibuprofen, and antibiotics. So next is spondylosis, or the general term cervical spondylosis. Spondylosis is defined as the degeneration and ankylosis of the vertebra resulting in pressure on the spinal cord and spinal nerve roots. It is often applied to any degenerative lesion of the spine. Spondylosis, guys, is actually very common to people older than 60 years old. Based from my research, 85% of 60 years old are affected by this disease. And this condition can lead to variety of problems such as herniated disc and bone spurs. So, what are the causes of spondylosis? Actually, based from my research, there are 3 causes that I had researched: herniated disc, bone spurs, and stiff ligaments. When we say herniated disc, it is a crack appear on the exterior of the spinal disc, and within these cracks, the soft interior of the disc can squeeze. Napipiga siya, guys. Parang ganon. And the second is bone spurs. Bone spurs. As the disc breaks down, the body produces extra amounts of the bone in a misguided effort to strengthen the spine. And these bone spurs can pinch the spinal cord and nerve roots. And last cause is the stiff ligaments. These ligaments are cords of tissue that connect the bone to bone. Spinal ligaments can stiffen due to old age, making the neck less pliable. And what are the symptoms naman of spondylosis? As what I have said in the bone spurs, if the spinal cord or nerve roots become pinched, we might experience first tingling, numbness, and weakness in the arms, hands, legs, or feet. Second, lack of coordination and difficulty in walking. And the last symptoms is loss of bladder or bowel control. So the third condition is subluxation. Guys, clarify ko lang subluxation and luxation is different. When we say subluxation kasi, it is a partial dislocation lang, partially. At kapag luxation, buo na siya, buong dislocation na po yun. So, ayun. Subluxation is a partial dislocation. Subluxation actually a result of acute injury or repetitive motion of injury. And what are the causes? The causes of subluxation are blunt forces injuries, overuse injuries, and hyperextension or the joint hyperextension. When we say blunt forces injuries, these are the sports injuries or the several fall and motor vehicle accidents. And when we say overuse injuries like medial epicondylitis or the patellar tendonitis. And when we say joint hyperextension, these are injuries that occur when a joint is extended. So, what are the symptoms of subluxation? First is the pain and swelling around the joint. Pag masakit yung mga joints nyo, lagot. Second is the sensation of the joint instability. Third is the bruising. Last is the loss of feeling or numbness. So let's go to the next condition, which is the thalites, or also known for club foot. Thalites is a deformity of the foot, especially one occurring congenitally, or the club foot. Actually, thalites is very unique. It usually occurs in 1,000 child. It is a common foot abnormality which foot joints downward or inward. And furthermore knowledge, actually it occurs twice in males than females. Like 2:1 siya. And also, thalites can be present at birth. Pwede siya maging inborn. So what are the causes of thalites? Actually, there are two causes, the extrinsic and intrinsic. When we say extrinsic, this type is mild and supple. The cause can be due to intrauterine compression, large baby, or the abnormal shape. And kapag sinabi naman natin intrinsic, it is more severe. And the calf muscle is smaller. Yung butoy natin, maliit. So what are the symptoms of thalites? Symptoms are the stiff, rigid foot of ranging degrees. Varying degrees. And second is the heel is turned in. Short and tight Achilles tendon with joint pointing downward. Ayun yung mga symptoms. So guys, when we say thalites, it's also known as club foot. So next condition is valgus. Oh guys, baka malito na naman kayo. Valgus is bent outward and varus is bent inward. Ay, clear yan. Okay, that's good. Valgus is a condition in which bone segment distal to a joint is angled outward. So what are the causes of valgus? First cause is the developmental, like physiologic, no intrinsic bone diseases, trauma, like malunion fracture, asymmetric growth due to fractured, and last cause is the arthritis of knee. So, punta naman tayo sa symptoms of valgus. The symptoms are pain and stiffness of the big toe joint. Second is difficulty in walking. Third is smelling of the big toe joint. Okay, next condition. Sa varus naman tayo guys. When we say varus, it is bent inward. bent inward siya, guys. It is an excessive inward angulation. And virus is common in newborns since their bones are still developing due to lack of vitamin D. Kaya kung mapapansin niyo guys, yung mga bagong panganak, ganun, di ba nilalabas nila sa labas para painitin kapag umaga. Ayun. Kasi from the sunlight, nakakakuha pa tayo ng vitamin D. So, what are the causes of virus? The causes are bone infections, bone tumors, and bone injuries. And symptoms, the common symptom is bow leg. Yan. Ayun lang po yung virus. Basta ang difference ng valgus and virus, when we say valgus, bend outward. And when we say virus, bend inward. Ayun lang po, wag sana po kayo balito doon. And the last condition is von Recklinghausen disease. Von Recklinghausen disease is loss of bone tissue caused by increased parathyroid hormone. Bones become decalcified and deformed and fracture easily. When we say von Recklinghausen disease, guys, it also called neurofibromatosis 1. And it is a genetic disorder characterized by increased risk of developing non-cancerous and cancerous tumors. But based on my research, von Recklinghausen disease is considered as benign. So what are the causes of von Recklinghausen disease? Von Recklinghausen disease is caused by genetic defects, or we call mutations that either pass on by a parent or occur spontaneously at conceptions. Ayun po. And what are the symptoms of it? Symptoms are flat light brown spots on the skin. Kabahan na kayo guys. Kapag may nagkaroon tayo ng flat light brown spots on the skin, kabahan na talaga tayo. Second is the bone deformities. Third is the freckling in the armpits. And last is the short stature. And that ends the symptoms and conditions of the skeleton. So I hope guys learned something from our presentation. Hopefully. So anyways, thank you for listening guys. Well appreciated. Thank you po.